patients diagnosed and who are under radiation, and none of them, this is very important sentence, none of them has recurred. And my first patient of this series is 20 years back. I mean, what I just want to tell you, the HPV positive cancer, especially of the larynx, is well managed with radiation with excellent results. So this is in the anterior commissure. Anybody? How you are going to manage Dr. please?
Very difficult, but still sometimes we are using coblation and sometimes we are using the microdebrider with screamer blade. We are using what I have seen when it in two-stage operation. When it touching the anterior commissure, chance of sanity or anterior formation. So generally we want to do not in a single setting, staging surgery.
So this is very important, I think. Anterior commissure laryngeal papillomas have been treated carefully because chances of anterior glottic web formation, and they can be done in two sittings. Doctor, what instrument you will use here?
Yes, I just want to personally comment on that. After removing these materials and tissue, histopathologists nowadays usually suggest for immunohistochemistry in almost all cases to come to the real diagnosis if it is really related to multiple papilloma is related to other things. So in that cases the exact diagnosis comes, and in that case only I think radiation and other questions arises.
Yeah. What instrument, Dr. Tarabdar would?
Yeah, Doctor, I agree with Dr. Tarabdar that we also prefer to do microdebrider assisted resection, but only for the bulk of the tumor. When the main bulk of the tumor is resected, then we have to switch over to some precision tools. Mainly, if you have access to CO2 laser, that is the best, because if we keep on using the microdebrider, then we are going to go beyond the mucosa. And papilloma is actually an epithelial disease. And the moment we make it subepithelial and go to the deeper layer accidentally with microdebrider, then the spread will occur more rapidly. Probably.
Yeah. So this is very important point. Papillomas are bulky and they come and they hang around the edge of the vocal fold. So to remove the bulk, you can use a cobblator or a debrider, these types of instruments, and as you go close to the edge of the vocal fold, then you can shift into sharp scissors or a CO2 laser like a precision instruments. Just one point, if you have a KTP laser, would you use it, and what's the advantage of KTP laser over all other instruments? Anybody?
KTP is good, but now it is not available.
Yeah.
When we have KTP, then we use the KTP laser.
So only advantage of KTP laser over CO2 laser is KTP is known to block the vessels, so angiogenesis. So it would block the vessels around the papilloma and it will spread the papilloma virus going around, and again chances of recurrence are less. So that's the only property of KTP laser which is beneficial for cases of laryngeal papilloma. Yeah.
We can also use the screamer blade because it's a very precise cutting. When you use the sharp scissor rather than the screamer blade, so can we use the screamer blade other than precise scissor?
Yeah, absolutely. See,
screamer blade can be used.
As I told yesterday, you should be comfortable with your instruments. Only principles have to be kept in mind. As you go close to the vocal cord, you have to use precision tool. What precision tools you decide after your availability and your skills. Yeah.
One thing, so then what is the advantage of blue laser?
Yeah, the advantage of blue laser is again, so it's same as KTP. So it is, please, William.
Yeah, what I do is I don't apply the papilloma, I go to the base of the
Base, yeah.
papilloma and lace it with a blue laser. That way it would ablate all the blood vessels, blood supply. It would the recurrence would be less. But we need more studies to prove that.
Yeah, absolutely. But somebody said in the morning, I think Brandon said in the morning, the availability of KTP laser is going down in the world markets. The cost is exorbitant for the KTP laser. I think a good parallel or replacement is a blue laser, and the physical properties of blue laser are similar to the KTP laser. So I think blue laser is a good reference. We have seen Dr. Williams' clip in his yesterday's talk. What he would do is, rather than going to the bulk, he will go to the peduncle or the edge of this one, and he will vaporize here, and then just forceps would take care of this bulk, and it will block the blood vessels also like a KTP laser. Now this is a case. So the papillomas have gone down into the lower airway. So there are two questions, 2 points I want to mention. Number one, even your video laryngoscopy shows this picture, glottic carcinomas, patient doesn't have any breathlessness, but make it a point to pass in your bronchoscope and check the entire airway, because this could be skip lesions which we will miss. Suppose the picture is like this. In the lower airway, patient have got mild breathlessness. Would you go into tracheostomy? Just maybe 2 or 3 sentences. Yeah, doctor. Once.
Actually,
Yeah, anyway.
previously we were doing tracheostomy,
Yes.
but after coming of coblation
Yeah.
and jet ventilation, it is not used the part. And you have to go through the bronchoscope, even fibrocom will go up to the carotid, see where any area, any skip lesion is there.
Yeah.
Before the doing surgery, now we are doing the fibrocom bronchoscopy to see the area.
So this is very important. Now, just because of these instruments availability, the blades and the fiber transmissible laser, you can very well go down in the bronchi and trachea and remove the laser, and that's ultimately going to save the patient for tracheostomy. Okay, so that's the advantage the patient is going to have, because there are disadvantages of tracheostomy like settling of the papilloma in the lower respiratory tract because of the tracheostomy. And same, I was also sorry. So, okay. So this was in the bronchus, and actually this was so much skip, there was nothing between the vocal cord and the bronchus, only skip lesion there. So I mean it's important. This technique actually in my conference, just to have a good diagnosis, you should do flexible laryngoscopy. And that's everybody would going to do. But flexible laryngoscopy, what we do, will show picture like this. The posterior glottis here and anterior glottis. So this picture of flexible laryngoscopy would be like this. A reverse picture. But in the case of papillomas, you have to check the anterior commissure and the subglottic area, and for that you have to use this skill. This is called as reverse scopy. So you just have to turn this laryngoscope and check the larynx anterior to posterior, and that would show you the anterior commissure very well.
Okay.
Okay, not only it shows you, I mean, this clip is not playing. Okay. See, now the reverse endoscopy is absolutely showing the anterior commissure down into the subglottis, and see the trachea also you are able to see. So, this actually I taught in our state conference also. My fellows are here for maybe like 2-3 hours, but our clinic is running, and this is just our skill, a small skill which you can learn within half an hour. So get it through. Just turn your flexible laryngoscope anteroposteriorly and do the reverse endoscopy. Okay. A role of office-based procedures to remove tracheal and even the vocal cord papilloma. So this is again coming up with the advent of KTP, diode and a blue laser. You can get rid of these papillomas in the bronchi, in the trachea, and small papillomas in the adult age group over the vocal cords on office as a office-based procedure. So I think we had very much good discussion on blue laser and all these lasers. So this is again a new technique which you can adopt. So, role of narrowband imaging. Narrowband imaging is available in each and every scopy set you are going to get. Olympus would say it NBI, Pentax would say it as a eye scan. But it would show and help to have early diagnosis of malignant nature of the tumor. So it helps, and please use it as your endoscopic procedure. Imaging again is necessary to check the skip lesions. Okay. HPV serotyping. I would just like to understand. Anybody has been doing serotyping? Dr. William, please let us know what are the advantages of serotyping.
There are different types of HPV. One is the more aggressive ones, and the less aggressive. It would be very good for prognostication and of recurrence of the papilloma.
Yeah. So as we know, what would be the usefulness of doing HPV serotyping for these patients? Anyway, it's not going to guide us to the treatment part, but you can talk to the patient and patient's relative. If it is happens to be number 11 or maybe 17 or 18, then you can tell the patient that this is likely to be aggressive and you need to undergo multiple surgeries. If it is 17, 18 or 34 or 50 and such types, then there are chances of it's going to have malignant transformation. And these patients, do you like to immunize them? Yeah.
Now, I started routinely giving immunization to these patients.
Yeah. So these patients who turn out to be having papilloma virus of maybe 11 or especially 17, 18, then you can give them Gardasil or this type of immunization which are available in our medical stores anywhere. So that can prevent it to turn into malignancies. What are the anesthetics important? Why they are important? Same as Dr. Karadhar has told, especially children, they come with breathlessness as the main complaint, and adults will come as change in voice as the main complaint. In children, you need to avoid tracheostomy at any cost, and for that you should have good anesthetic instrumentation available. So mainly HFNO, high frequency jet ventilation, and this is the tube which has been developed by Mr. Oswal. So this is Oswal-Hunter metal endotracheal tube which we use in pediatric patients to just intubate quickly, and then you can use the laser just to debulk the lesion and open up the airway. And how does it going to help you? Again, avoid tracheostomy. One question, Dr. William, what are the chances of endotracheal tube taking your papillomas along with it to the lower respiratory tract? This is known, more of a theoretical, but any experience or any comment?
So far, I don't have any experience with that.
Yeah.
And I think sitting with a not raw area is quite low.
So maybe just you have to keep in mind, don't do multiple intubations, especially with endotracheal tube, large endotracheal tube, because it will take papillomas down. Some of the papillomas can go with the endotracheal tube down into the bronchi. So do suction after you taking out the patient with the laser with this the tube. Suction this button. Okay. Now a treatment goal of therapy is again reduce the tumor burden, normal morphology and anatomy. This is very important. Prevent distal spread of the disease, optimize voice quality, and increase the interval between the procedures. Mainstay of treatment, surgical care with minimal damage. Okay. We have already seen this KTP, CO2, copulator and debrider and cold instrument. We have already discussed this. We have discussed also the role of office-based procedures. Okay. In my experience, this is a tumor or the papillomas in the epiglottis, I mean a laryngeal surface of the epiglottis, and this is again the laryngeal surface of the epiglottis. Any comments, Dr. William? How do you remove these papillomas? Because see, when you enter, they are upwards.
The papilloma is of the epiglottis, the laryngeal surface of the epiglottis.
This one and this one, yeah. The same actually.
I use a Lindholm laryngoscope to expose the laryngeal surface of the epiglottis.
Yeah. So basically, these papillomas are known to recur because of inadequate removal, because the access is not good. Access is good for papillomas in the posterior condition. Okay, because the blade of the laryngoscope is upwards. So what you have to do is use again 30 degrees or 70 degrees endoscope, see upwards, use a cup upward forceps, upturned forceps, and then plug the papillomas. If you have got a diode or KTP or what type of laser, it always has a probe, and probes are malleable probes. So you can just turn the probe upwards and get rid of the papillomas maximum possible. But remember, these papillomas are important to diagnose and then manage. Okay, we have seen these things.
The Lindholm laryngoscope to expose the laryngeal surface.
Yeah, Lindholm laryngoscope. Actually, Manjunath also told in the morning, has got a wide this diameter, and it gives excellent exposure.
You insert it at the tongue base, actually flip off the epiglottis.
Yeah, and this is very important point. If you have a normal laryngoscope, you just put it down, then you will go through the papillomas down onto the vocal cord, and you will miss these papillomas altogether. So this Lindholm laryngoscope, base of the tongue, and just flip the tip of the epiglottis, so the papillomas will be in front of you. Okay. Now this diffuse laryngeal papillomas, that is on the surface of the vocal cord. They are not at the edge of the vocal cord. They are on the surface of the vocal cord. How do you manage? Yeah, so again actually I have managed it with scanning mode of CO2 laser, luminous laser. But yeah, that's the best possible I think as of now. And you can have very good results after that. I don't know whether this will play. But I mean, this could be the pictures when they are on the surface and not at the edge of the vocal fold. Okay, recurrence why and how to prevent. So these are recurrence with anterior wire. Any adjuvant therapies anybody is using?
I've used
And their experience.
I've used Avastin, I've used Citovavir.
Might mention Sedan.
Actually, it's not really helping. I'm trying to use
Corticosteroid.
Avastin systemically now, 10 milligrams per kilogram. Then I'll report once we have the results.
Apart from Avastin and Cidofovir, anything else you are using? Interferon or I mean?
Before I've used interferon, but it doesn't work. Actually.
Whether it is scientifically feasible or not, in our Bangladesh University, we have got 7, 8, 9 times per person they come to us for recurrence. So it is very difficult in this patient. Some of the patients we have seen now with the anterior wave, anterior synetia, this patient has complication because they were with the tracheostomy for 5, 7 years. Now we are using some of the homeopathic medicine. Some of our colleagues come to us and we have seen there is no recurrence. I don't know whether yes.
Anyway, I mean, this is the topic maybe in the with the conference.
Scientific.
Yeah.
Scientific, yes.
Thuja.
We are starting pseudophobia.
Yeah. So, I mean, anybody has got some
All of us knows the
maybe a longer
Yeah,
series
I
of
used to use it.
Silofovir or Avastin.
Probably good results.
Okay, so Silofovir and Avastin have got their role, though not really foolproof as yet, but they are under trial. We have done our own study and our own case reports, I think, of Avastin and Silofovir both. There are 2-3 patients from long distance. They are coming to us from Gujarat and these patients, young patient, and we have been able to avoid tracheostomy. He is coming to me for last 15 years, and we are really avoided tracheostomy for that patient. And I think for last 5 to 6 years we are giving Silofovir. So he comes once a year. So I think, and now his voice is quite good. So I think there are some advantages. Avastin we have used almost in each and every adult patient. We are using Avastin, not compared with any other series, but they are known to have some benefit. So this is actually local injection of Avastin or Silofovir, which can be easily done because anyway we are doing surgery. Avastin is not costly, so it can, and it's readily available. It doesn't have much of a side effects, so Avastin can be used. Silofovir is costly, not available legally in any of the markets. So that's how you get it through and use that Silofovir. But systemic Avastin, just can you tell us few, because I just used for one patient. But
There are studies now that shows that systemic Avastin would decrease the recurrence rate of
Yeah.
papilloma.
and any risk factors for systemic Avastin?
No, it's not really. The side effects so not that much.
Not much. So I think this new study and is coming over with systemic intravenous use of Avastin, and that is again a trial we can start using them. Okay. So these are available. Systemic also dosages is being given. The more severe and aggressive disease, it has got some benefit. Last point now. Role of
Just from the idea why, in fact, I'm going back, why he used Thuja. This I don't know whether it is in the Indian culture, but it is in our culture. Because children growing with warts in the face, warts in the body, we used to send them to homeopaths because they do not have any medicine. And after what medicine they have given, these are just shaded from them. And because these are papilloma things, then we used to come to know that they use the Thuja. And because these are laryngeal warts, and even in genital warts also, this Thuja comes useful, and the concept comes from there. That's why this is not used in all the people, but it is, in my experience, it is somewhat useful.
Yeah, I think Thuja basically for any child coming with recurrent respiratory papillomavirus, we can always ask the patient to have the homeopathic consultation and then start Thuja as per their discretion. Yeah.
Actually, sir, Thuja, we see that there is very good result with Thuja. And I have sent some of my patients to homeopath, and the result is excellent. Found like that.
Yeah, absolutely.
Another thing.
কি ঠিক থুজাটা কি
Your vaccine.
থুজা তো আমি খাচ্ছি
How it is used in your setup.
থুজা আমি এখন খাচ্ছি হ্যাঁ
Vaccine. Yeah, that's actually yeah. Papilloma vaccine. Now we are using it for those who have shown seropositive 17 and 18. For them, we are giving them 3 doses of immunization.
কেটে দিই
Yeah.
আপনি হঠাৎ করে বলছেন আমি কাটবো না
For 11, generally 11 are seen in younger age of children, and they are aggressive. There is no role of
আনবিলিভেবল
this vaccine as of yet known. But 17 and 18, yeah.
আমার সেম জিনিস কিন্তু আমার তো অত ভালো রেসপন্স
Now, Just,
দুই তিন দিনে
I
সেরে
always
গেছে।
ask them
সেটা
to
কি
have
মানে
chicken
ওষুধের নাম?
vegetables like
ওষুধের নাম
batata
কি?
and rata and all this
আমি
cabbage.
যে ওই দোকানদার সরাসরি বললাম যে পূজা আছে
This is only I tell relatives.
বললো আছে
আসলে কি থাকে ওটা?
Antiviral
Antiviral
কম্পোনেন্টের নাম
anti-reflux
হচ্ছে
again.
পূজাই হচ্ছে মলিকুলার
Recurrent epithelial damage. Celecoxib is used as an
ওষুধ বানায় ভালো
anti-inflammatory.
ফরেনার তো এমনভাবে তাকাচ্ছে যে এটা আসলে কি জিনিস।
না হচ্ছে কি ওই
Uh,
জিনিসটা তো
I think the whole idea is can we have some guidelines
কম করে ওরা জানে না
for
আন্দাজে
the people or the surgeons in this part of the world, that is Asia Pacific
ওটা কোনো
basically.
কেমিক্যাল এক্সট্রা
So anybody, Dr. William, yourself, any point yet not covered in the panel discussion, if you want to have some points, then at least we'll note them down and get up in our what you say guidelines paper.
Yes. One thing we should avoid tracheostomy in all patients.
Yeah. So I think
It
that's
should do
very
in the first
important.
session. It should be done in the only tertiary care center available. But the good anesthetists and others are available. Third, you have told, because in our country it is not possible to find out the word, it is 11, 17 or 18. So can it be used in human papillomavirus in all recurrent cases?
Yeah, actually human papillomavirus, I don't know, we'll have to find out whether it's available anywhere in your country, but it's available not in Pune, but we sent it to Mumbai and it just costs 3,000 rupees.
Yes.
So it's easy to
Because in our
achieve.
country, females are getting this, in government level it is available.
Huh.
So why
Any-
not the male? There should be a protocol. In Sri Lanka, I think the protocol everybody.
Yeah, I don't know, any country, I don't know, Sri Lanka or Philippines, like Indian government has made it compulsory for all females to have the vaccine, but not males. I think in some European country nowadays they have become mandatory for each and every person. Yeah. So not amongst our countries as yet, but maybe 2-3 years down the line, we can write a letter on our applause behalf to all the governments.
Yes, sir, you should write to your government even.
Yes.
So only the females are getting in Bangladesh. Okay, sir.
Any points? Yeah, please. Yeah. I haven't seen. Sorry, sir. Yeah. Your comment.
So in Singapore, unfortunately, the mandatory, the one they give the teenage girls at age 13, is the Premarix, is the one that prevents cervical cancer, but it's not the quadrivalent one, Dr.Anisur, which also covers 6 and 11, which are the HPV, RRP ones. Yeah. So that's the problem.
And only last point, I would like to tell you, any young patient, if he comes to be having laryngeal cancer without any risk factor, and risk factors what we know are basically tobacco consumption and maybe alcohol, then please send his biopsy for HPV serotyping. That's the good part, because if they come positive, just send them for radiation, and radiation has got HPV positive, at least laryngeal carcinoma, the results are excellent. Excellent. So this is the practice, maybe we can start off right now. All laryngeal CA patients, just send them for HPV serotyping for further management. Yeah, please.
Sorry, got one question, sir. Do you have any concerns about jet ventilation for RRP disease, about seeding or any aerosolization of the virus?
No, not really, because the jet is going to go down and whatever comes is out. So that's my another question. Yeah, it's going to get the viruses to your eyes. Again, this is a theoretical assumption, but maybe 1 or 2 cases reported till now, but not a routine thing. Our surgeons' eyes would get in the papillomavirus.
Thank you, sir.
Okay, thank you.
So now Sotin is leaving, so it's a good clap for him. Thank you. Okay, we will come in again for the whole show.
Sir, quickly.